So have you ever heard names like pigeon fever or maybe dryland distemper or put it another way? What if I told you about this bacterial infection in horses? It can cause these huge external abscesses or even really dangerous internal disease. Today, we're doing a deep dive into Corynebacterium pseudotuberculosis. That's the bacterium behind these conditions, specifically how it hits horses.
Exactly. And our mission really is to give you a quick but solid understanding of this, well, significant challenge for horses. We're digging into the sources you sent over, pulling out the key stuff. We'll look at how horses get it, the incredibly different ways it shows up, from stuff you can easily see to dangers hidden inside. Plus, the diagnostics they use now
Yeah.
and the treatments and prevention, which honestly can be quite complex but are so important.
Right. Okay, so let's start with the basics. What is this bacterium? Corynebacterium pseudotuberculosis. You mentioned it's gram-positive, so thick cell wall, and it lives in the soil. And it causes pigeon fever because of how it looks, right? And it generally shows up in three main ways.
That's the one. It's like a gram-positive rod, lives in the soil, causes those conditions. And yeah, three main forms, usually in this order of frequency. External abscesses first, then internal infections, and also this really nasty skin thing called ulcerative lymphangitis. And what's really critical to understand, I think, is its survivability. It's an intracellular facultative anaerobic rod.
Okay, break that down a bit. Intracellular, facultative anaerobic.
Right, so intracellular means it can actually live inside the horse's cells. And facultative anaerobic means it can survive with or without oxygen. Makes it pretty tough. Mostly it gets around via mechanical vectors, flies, basically.
Just hitching a ride.
Pretty much.
Mm-hmm.
Sable flies, horn flies, house flies, the big ones. But it can also spread horse to horse or just from contaminated soil. Think of flies as this, like, unwanted delivery service just buzzing around with bacteria you definitely don't want.
So flies aren't just annoying pests here. They're actually moving the disease around, that transmission. How does it work exactly? Are they just carrying it on their feet or?
Yeah, mostly mechanical carriers, exactly. The bacteria usually gets in through broken skin or maybe mucous membranes, often through tiny bites from those insects, especially, along the belly line, the ventral midline. Once it's in, it sort of hangs out for a bit. The incubation time is usually around 3 to 4 weeks before you see any signs.
3 to 4 weeks. That's quite a wait. And doesn't it produce some kind of toxin? Something that helps it spread?
It does, yes.
Yeah.
An exotoxin called phospholipase D, or PLD. This toxin is really key to how the bacteria spreads. It basically increases the permeability of blood vessels, kind of like making tiny leaks in the pikes.
Ah, okay.
And that lets the infection move more easily through tissues and the lymphatic system. That's what
Yeah.
causes the swelling and pain you see locally. For the internal abscesses, the spread is usually via the bloodstream or the lymphatics. But the good news is, most horses with a healthy immune system, they usually fight it off after just one infection.
That's good to know that most can clear it. But for the ones that don't, or where it gets more serious, where does this thing actually set up shop? External abscesses, we're talking skin, lymphatics, muscles, right. But internal sounds like anywhere.
You're pretty much right. If it goes internal, it really can affect almost any organ.
Mhm.
Liver, kidneys, lungs, sometimes even the nervous system or reproductive organs. And that other one, ulcerative lymphangitis, that mainly hits the musculoskeletal system and the lymph vessels in the legs, causes really bad inflammation.
So for you listening, it's crucial to get that this isn't just a skin problem. It can really get around the body. Where and when do we typically see this? Is it everywhere?
Well, it's considered endemic, meaning it's usually present in the southwestern U.S. But honestly, we're seeing it across North America now. Its range seems to be expanding. On farms where it's endemic, you tend to get sporadic cases, just one here, one there. But if it gets into a population of horses that haven't seen it before, the incidence can be much higher. And here's a really sobering point: the mortality rate for external abscesses. Thankfully, it's low, less than 1%.
Okay.
But for internal infections, it jumped dramatically. We're talking 30 to 40% mortality.
Wow, that's a huge jump.
It is. And while any age horse can get it, foals under 6 months seem less affected. Maybe some immunity from their moms in endemic areas, and there's no sex difference we know of.
That mortality difference is stark. It really highlights that hidden danger. So, okay, if I'm a horse owner or a caretaker, what signs should actually make me suspicious? Let's start with the external abscesses. What do they look like?
Okay, for external ones, first maybe you've heard of other cases nearby, that's a flag. Then you'll typically see swelling, maybe edema, in places like the chest, armpits, under the belly, the groin area. This swelling then develops into these larger lumps. They're painful, usually quite firm. As they mature, you might feel a soft spot right before they burst. The pus inside is usually sick, kind of tan-colored, and surprisingly doesn't really smell.
No odor. Interesting.
Yeah. You might also see a swollen limb or lameness, especially if an abscess is near, say, the triceps muscle or in the groin. But what's often surprising is that horses with only external abscesses, they usually don't seem systemically sick. Maybe a low fever, a bit sluggish, off their feed slightly, but often not profoundly ill.
And that classic pigeon breast look, that's where the name comes from, right?
Exactly. That pigeon breast is from abscesses forming right there in the pectoral muscles, the chest, making it look puffed out. But they can show up elsewhere, too. Belly, armpits, sheath, udders, even the head sometimes. And they can get big, up to 20 centimeters across before they pop. Now, for the internal infections, the signs are way more subtle, much harder to spot.
How so?
Well, they're often really nonspecific. Depends entirely on which organ is involved. You might see a fever that just won't go away, loss of appetite, weight loss, lethargy, maybe that dependent edema swelling in the lower legs or belly. If it's in the abdomen, maybe signs of colic or they seem painful in their belly. Respiratory signs like a cough or trouble breathing. Could be lung involvement. Lameness could happen if abscesses are deep in muscles or joints. And here's the really tricky part. Horses with internal abscesses might have no external signs at all, which makes diagnosis incredibly difficult.
Yeah, that sounds like a massive challenge for diagnosis. What does that mean practically for the vet or the owner? Are there things it gets mistaken for often?
It means you really have to be a detective. Because the signs are so vague, internal abscesses can look like a lot of other chronic illnesses. That's why a really thorough history and exam are key, followed by leaning heavily on more advanced diagnostics. Without those external clues, it's a genuine medical mystery sometimes. And speaking of tricky forms, there's that other one we mentioned, ulcerative lymphangitis.
Right. Describe that one for us.
Ulcerative lymphangitis is this severe inflammation and infection of the lymphatic vessels. It often shows up as really extreme swelling in one or more legs, usually the hind legs. You'll see cellulitis that's like a spreading skin infection, and then multiple draining sores or tracts that kind of follow the path of the lymph vessels up the leg. Looks like angry, inflamed lines. It usually comes with severe lameness, fever, lethargy, not wanting to eat. And unfortunately, it can become chronic, keep coming back. Really tough condition.
Okay, so those are the big three. Are there other, maybe less common signs people should be aware of, signs that this bacterium might be involved?
Oh, absolutely. It can be quite varied. You might see lameness from osteomyelitis, that's bone infection, or septic arthritis, which is infection inside a joint, or even tenosynovitis, inflammation around tendons.
Okay.
Neurologic signs are possible too, though less common. Things like meningitis or stridor or noisy breathing from inflammation in the larynx cartilage, arytenoid chondritis, or nasal discharge if the sinuses get infected, sinusitis. And in mares, you could potentially see things like vaginal discharge or even abortion if the uterus or placenta get inflamed, metritis or placentitis. It's this huge range of possibilities that really makes diagnosis a challenge sometimes.
So moving to the cause again, we're talking Corynebacterium pseudotuberculosis, biovar equine, specifically for horses. Is there anything else similar it could be confused with?
Good point. It's important to know it's different from biovar ovis. That's the one that causes Cayce's lymphadenitis, or CL, in sheep and goats. Looks similar, but it's a different variant. And thankfully, it seems there's no natural cross-species transmission. Your horse isn't going to catch it from a neighboring sheep.
That's definitely a relief. So risk factors. What puts a horse more at risk for getting this?
Well, living in one of those endemic areas is obviously a big one. We also tend to see more outbreaks when it's hot or during drought conditions. Most cases pop up in late summer and fall. Also, if you have a wet, mild winter followed by an increase in insects, that's a major risk factor. Poor fly control, obviously.
Makes sense.
And horses with method immune systems are more susceptible. And importantly, this bacteria can survive in the environment for a surprisingly long time, up to 8 months in soil that's mixed with manure. So contaminated ground is a persistent source.
8 months. Wow. Okay, so we know the signs, the risks. How do vets actually confirm it, diagnose it definitively?
The gold standard is bacterial culture. That means taking some of that pus, the exudate, from an abscess and growing the bacteria in the lab. You can send in samples from an aspiration where they stick a needle in, or swabs from a draining tract, or even little skin biopsies. Sometimes just looking at the cells from the sample under a microscope, cytology can give clues. You might see those characteristic gram-positive rods, often pleomorphic, meaning they vary a bit in shape.
Okay, culture is key. What about imaging, especially for those really difficult internal cases?
Imaging is absolutely vital for internal cases. Ultrasound is probably the most valuable tool.
How so?
It's great for finding abscesses inside the abdomen or the chest or even deep in muscles. You can actually see them. And ultrasound can even help guide a needle if you need to get a sample for culture from one of those deep abscesses. X-rays or radiographs are more useful if you suspect the bone is involved, like with osteomyelitis. And blood tests, while not specific for this bacteria, can definitely support the diagnosis. They show signs the body is fighting a major infection, like high white blood cells, high inflammatory proteins, maybe even anemia.
So lots of pieces fitting together.
Exactly. And you can also use PCR testing that looks for the bacteria's DNA on samples like fluid from the abdomen. That can be helpful if maybe the bacterial numbers are low or if antibiotics were already started, which might interfere with culture.
Okay, that makes sense. Now, there's also this test called the SHI test, synergistic hemolysis inhibition. What's its role in all this?
Ah, yes, the SHI test. It measures antibodies in the horse's blood, specifically antibodies against that PLD exotoxin we talked about. It's most useful as an extra tool for diagnosing internal infection, particularly when you don't have any external abscesses to sample and culture. A high SHI result, usually a titer of 1 to 512 or more, combined with the right clinical signs and maybe those blood work abnormalities we mentioned, that strongly suggests internal abscesses. However, and this is really critical for you to understand, the SHI test is not perfect. It's generally not reliable for diagnosing external abscess.
Why not?
Well, it can't really tell the difference between an active infection right now and an infection the horse had in the past, or even if the horse was vaccinated. So a positive result needs context.
Got it.
It really has to be interpreted alongside everything else, horses' signs, other test results. It forces vets to be those medical detectives again, putting all the clues together.
Right.
It's just one piece of the puzzle.
A piece of the puzzle, not the whole picture. Understood. Okay, let's shift to treatment. I imagine this varies a lot depending on which form we're dealing with.
Oh, absolutely. And this is where knowing the details really matters. For a straightforward external abscess, the main treatment is just supportive care. You want to help it mature, rupture, and drain.
Like how?
Think hot compresses, poultices, maybe hydrotherapy using warm water. The goal is to bring it to a head. Once an abscess is mature, a vet will often lance it surgically, make an opening, and drain it. This is actually better than letting it burst on its own,
Why is that?
because you can control the drainage better and, importantly, minimize how much contaminated pus gets into the environment. After draining, the cavity needs to be flushed out daily, usually with something like dilute betadine, until it heals from the inside out. Now, here's something that sounds counterintuitive, but is crucial. For simple external abscesses, antibiotics are often not recommended.
Really? For a bacterial infection?
Yeah, it seems odd, right? But the thinking is that antibiotics can sometimes actually slow down the resolution. They might sort of wall off the bacteria inside the abscess capsule instead of letting it properly drain out. It kind of teaches us an important lesson about sometimes letting the body's defenses and natural drainage processes do their work.
That is surprising. So when are antibiotics the right call?
Okay, antibiotics become necessary if the horse with external abscesses also seems systemically sick, feverish, lethargic, or if they keep getting recurrent infections, or if the horse has a known immune system issue. And they are absolutely essential, non-negotiable for internal infections and for ulcerative lymphangitis. Treatment typically needs to continue until all signs of infection are completely gone. The good news is the bacteria seems generally susceptible to many common antibiotics. Widespread resistance isn't a huge problem yet, but effectiveness depends on whether the drug can actually get into the abscess, if it works well in pus, and how well it tackles bacteria hiding inside cells.
Right, so which antibiotics are typically used when they are needed for external abscesses?
Common choices might include sulfa drugs like TMS or maybe tetracyclines, though some antibiotics just don't work as well inside those big acidic abscesses.
Okay, and what about for the really serious internal forms, the hidden ones?
For internal abscesses, long-term antibiotics are the main strategy. And I mean long-term, often 1 to 4 months, sometimes even longer.
Wow.
Your vet might choose drugs like minocycline, doxycycline, maybe enrofloxacin. Often they'll use a combination, sometimes adding rifampin, which works really well alongside another antibiotic. And monitoring is key. Regular blood tests, repeating those ultrasounds to see if the abscesses are shrinking. That tells you if the treatment is working. Sometimes if an internal abscess is in a place where it's safe to drain it, often using ultrasound to guide the needle, that can really speed things up.
And ulcerative lymphangitis, that
Yeah.
really difficult leg infection.
Similar approach to internal abscesses. Aggressive, long-term systemic antibiotics are crucial. But local care is just as important. That means things like hydrotherapy, hot packs to draw out an infection, keeping the leg wrapped, and daily cleaning of those draining tracts. Pain relief is important too, usually with NSAIDs, non-steroidal anti-inflammatories, and owner education is huge here. Lesions that aren't draining aren't directly infectious, but the draining ones, they're loaded with bacteria.
So containment is key.
Exactly. Careful confinement of the horse, collecting all that discharge, disinfecting surfaces, disposing of contaminated bedding properly, ideally in a closed system. It's a real team effort to prevent spreading it.
Which leads perfectly into prevention. This seems incredibly important. What are the main strategies?
Flight control. Number one, absolutely essential to minimize that mechanical spread.
What does that involve practically?
Rigorous manure management is huge. Using fly sprays, fly sheets on the horses. You can even use feed-through fly control products. They make the manure less friendly for fly larvae to develop in. Getting rid of any organic debris promptly also helps. Beyond flies, just good general biosecurity. Using disposable gloves when handling infected horses, washing hands thoroughly, isolating horses that have draining external abscesses, and being meticulous about collecting and disposing of any pus or drainage. Think of it as containing the source.
Is there a vaccine available for this, or is it mainly management?
There is, yes. There's a conditionally licensed vaccine, it's a Bacterin, available from Boehringer Ingelheim in certain areas. It usually requires a primary series, typically 2 shots a few weeks apart. But it's really best to talk to your own veterinarian about whether vaccination makes sense for your specific horse in your specific location. Availability and recommendations can vary.
Okay. And any other potential complications we should mention beyond the main forms?
Well, widespread disseminated disease where the infection just spreads everywhere, that's a possibility, though thankfully not common. And something called purpura hemorrhagica, which is a severe immune reaction affecting blood vessels, can sometimes occur after infection. Again, less common, but serious if it happens.
Let's touch on prognosis then. What can an owner generally expect for these different forms?
Okay, for simple external abscesses, they usually resolve in about, say, 14 to 30 days. Sometimes new ones can pop up later from lymphatic spread, but overall the prognosis is generally very good.
That's encouraging.
Internal infections, though, they take much longer, often 90 to 120 days, maybe even more. The prognosis there is considered fair to good if it's caught, treated aggressively, and monitored really closely with those blood tests and ultrasounds.
And the lymphangitis?
Ulcerative lymphangitis also takes a while, usually 30 days or more of treatment, but also has a good prognosis generally, provided it's treated appropriately and consistently.
Right. Wow. Okay, we have certainly covered a lot of ground on Corynebacterium pseudotuberculosis today. We've gone from those very visible external abscesses, the pigeon fever look, to the much sneakier, dangerous internal forms, and that really challenging ulcerative lymphangitis, and highlighted how crucial diagnosis is using everything from culture to imaging to interpreting that SHI test carefully, and of course the need for specific, sometimes very long-term treatment.
Absolutely. I think the key things for you, the listener, to take away are, first, be really vigilant about fly control and keeping the environment clean. Second, call your vet promptly if you suspect anything. And remember those different prognoses depending on the form, and that there is a vaccine option to discuss with your vet. It could be a useful tool in some situations.
Definitely. And maybe a final thought for everyone listening to consider. Given how widespread this bacteria can be, just sort of hanging out in the environment, and how differently it can show up in horses, what does that really tell us about this constant battle going on between pathogens, the vectors like flies that spread them, and animal health itself? And maybe more broadly, how can we take this mindset, proactive prevention, catching things early? How can we apply that not just here, but to other areas, other aspects of animal welfare, or maybe even public health, something to think about?